Okay, I think we'll get started. I appreciate you all taking the time to learn more about NeedyMeds and more about assistance with neuroendocrine immune diseases. And we're really excited here at NeedyMeds to be partnering with the organization PANDORA on this webinar. So today what we're going to do is we're going to go over the NeedyMeds website, and we're going to specifically be highlighting those resources that those suffering from neuroendocrine immune diseases might need assistance with. And again, we're really excited that we'll be working with PANDORA on this webinar, and they've co-sponsored this with us. So, and we'll be talking a little bit more about them later. But again, thank you for taking the time to do this today. My name is Elizabeth Messenger, and I'm the Outreach and Education Manager here at NeedyMeds. Right now, you should see the NeedyMeds homepage up on your screen right now. I will have to keep everyone on mute just so that you can hear me better. But feel free to type in questions in the questions bar on your control panel during the presentation. I'll be answering questions at the end. So I'm just going to give you a little introduction about NeedyMeds. We're a national nonprofit organization. We've been around since 1997. Our mission is to provide information for people who can't afford the cost of their medications and health care. We have over 5,000 programs on the website and over 10,000 free or low-cost clinics. About 15,000 people visit our website each workday, and they look at over 60,000 different pages total. So our website is getting used a lot, which is what we want. When our current president, Dr. Richard Sagal, started the organization, he had 3 primary goals in mind. He wanted the service to be free and anonymous, which it totally is. We don't ask any questions of people who go to our website, and all of our information is free to access. He wanted it to be easy to use. Hopefully you don't have to click more than 2 or 3 times to get to the information you're looking for. He also wanted the information to remain current. We update our website every day. We make about 50 to 100 changes a day on the site. We have a staff of about 5 people who spend most of their time updating our website. So it's really important to us that our information remain accurate and up to date for our website users. Today we're going to go through our website again and talk about all the different resources we list. So the first thing we're going to talk about is patient assistance programs. As you can see, I'm pressing this button on the left-hand side there. And I just clicked on brand name drugs. So patient assistance programs are the programs run by the pharmaceutical companies that make the medications. They offer the programs for free or very discounted for those who qualify. So what you can do on our website is we're sort of like the yellow pages for these programs. So you can type it, you can look on our website and you can look up a medication you're taking to see if there's an assistance available for that medication. I do just see that the PANDORA president, Marley Silverman, just got on. I don't know if you want to say a quick hello, Marley, or you just want to keep listening.
Can you hear me, Elizabeth?
Mm-hmm.
Okay.
So can everyone else.
Oh, good, good. I am so pleased to be here today, and I do want to say a few words. First of all, to thank you, Elizabeth, for joining us on this wonderful webinar. This is something that has been one of my dreams from way back, to be able to share some of the potential resources that patients can locate to help themselves in order to have a better sense of wellness and healing. Financial issues have been a major concern within the neuroendocrine immune diseases community, and I know that may not be 100% what we need, but this is a first step and this is a beginning. And I very much appreciate NeedyMeds and you for helping us to get there. For some of you who do not know who I am, my name is Marley Silverman. I'm the founder of PANDORA. And this webinar is actually part of the launching of May Awareness Month 2012 for neuroendocrine immune diseases. And once again, I appreciate you for being here. Thank you, Elizabeth. You can have now the microphone.
You're very welcome, and we're excited to be working with you on this. So what I was starting to talk about was our database of patient assistance programs. We're kind of like the yellow pages for these programs, so we don't actually run the programs, but we list them on our website. We currently, I think, have over 500 programs listed on our website. So most likely you'd be looking up one of these programs by a medication you're taking, medication you need assistance with. We list them by brand name or generic. I clicked on brand name drugs, so we're going to go ahead and look at what we would call a patient assistance program listing. You can see this A through Z bar here, so they're all going to be listed alphabetically. And we are going to take a look at Celebrex today. So here you can see what's come up with what we call a patient assistance program listing. On the left-hand corner here, you're going to see the name of the program, Pfizer Connection to Care, and the company that runs it, which is Pfizer, their address and phone number, and the languages spoken at their call center, and a link to their website. On the right-hand corner here is a link to applications, and we're going to talk about the FPL income calculator a little bit more in a second. Here you see the medication we just clicked on, the Celebrex with the milligrams and the generic in parentheses. The first thing you're going to look at when you're looking at a patient assistance program listing is the eligibility requirement column. So this is actually who's eligible for a program, and based on income, insurance. There's no rules when it comes to setting up these programs. Different applications, different eligibilities, different timelines, which is why we try to list all the information here for you to make it easy for you to get to. You can see in this case that you can actually have insurance to get enrolled in this particular program. For some programs, you might not be able to have insurance. Some programs you might be able to have a private insurer but not public. It all varies, which is why we try to list it here. So you can have Medicare Part D. You have to be at or below 200% of the FPL. That stands for federal poverty level, which again we're going to talk about a little more in a second. Is there a medical diagnosis necessary? In this case, there's not one specified, and you must reside in the United States. This column is how you actually get the application, what you need to do, what the doctor needs to do. So in this case, you can call or download it from the website, and they'll fax or mail it to you, or again, you can download it from the website, and then you mail it back to the program. The doctor needs to complete a section and sign it. That's pretty common. Sometimes they also have to attach maybe a DEA or state license number or something like that. Applicant's action. What does the patient need to do? In this case, they need to complete a section and sign it, and attach proof of income. These are all pretty common as well. A lot of times we get questions about what programs will accept as proof of income, and they'll always specify that in the application what they accept. Oftentimes it's like a tax form or a pay stub, something like that. Who's the decision communicated to? The patient and doctor will be notified in writing within 2 to 4 weeks. So as you can kind of maybe start to tell, it does take some time to apply to these programs. So whenever you are filling out an application, you always want to make sure you fill it out completely, even if it means maybe writing NA in a couple of places, because if you do send an incomplete application, it can really delay a process. It already does take a little bit of time, even though it certainly is worth it. In the medication column, you're actually going to see how much is sent, where is it sent to. Here you can see we don't actually have a specified amount. Whenever you see not specified in these bullet points, that just means the program didn't want to release that information to us. Some programs will only release certain information to the patients enrolled in their program. Sent to, this is all the medications will be sent to the doctor's office, except Lyrica, which will be sent to the patient's home. Lyrica is just another medication on this program. This will happen within 4 weeks. And then we talk about how you get refills and how often you have to reapply. Most programs do require that you reapply every year. Sometimes you have to reapply for every refill even, but every year is pretty common. You always also want to check out the additional information at the bottom. That's going to be information that didn't necessarily fit into those bullet points. So we'll have exceptions if a medication is on back order, things like that. Now you can see it here that at the top it says program 1 of 5. Scroll down and see them all. What that means is there's more than one patient assistance program available for this medication that we were able to find. So whenever you see that there's more than one program listed for a medication, we just want you to know that we list our programs from most assistance to least assistance. So programs at the top, you might be able to get the medications for free, like this Pfizer program. As you scroll down, you might see more of a discount per card program or something like that. So we're not going to go through every listing, but each of these program listings will have a similar information. I mentioned that we were going to talk about the FPL income calculator a little bit more. A lot of programs do base their eligibility on percentage of FPL. This is going to be at the top right-hand corner of all of the patient assistance programs listings. So if you go ahead and click on that, that'll bring you to a little income calculator where if you are trying to figure out if you qualify for a program or if someone you're helping qualifies for a program, you can actually put in income. I'm going to put in $35,000 yearly for a family of 4, and I'm not going to check Alaska or Hawaii, but if you did live there, it would be a little bit different. And this person's at 151% of the federal poverty level. So that's just a quick tool for you. Again, it'll be at the top right-hand corner of all of our patient assistance program listings. And then again, here is a link to the applications where you can actually mostly complete them online and then print them out and get the patient's and doctor's signature. Okay, we're going to go back. You can also look up a program by generic name. It's going to be the same list of medications, just with the generic name first, the brand name in parentheses. If you're looking for a medication, you can't find them listed on either of these lists. I always do say check both lists because you might think you know the generic and you actually know the brand or vice versa. Then that probably just means there's not a patient assistance program available for that medication. Again, we're primarily an information resource, so we don't run any of these programs, and we are pretty good about updating when new programs come on. So again, if you can't find the medication, there are a lot of other resources out there, but there aren't patient assistance programs out there for every medication. You can also look up a program by program name. The only difference when you do this is you're going to see all the medications offered on that program. So we were looking at the Pfizer program before, and because we clicked on that one medication, the Celebrex, we only saw that listed. But if you look up a program by program name, you're going to see all the medications the program offers. You can see this one's pretty big. And then otherwise, all of this information will be the same. So if you look up a program by medication, you only see that one medication listed. If you look up a program by program name, you'll see all of the medications that program offers. You can also look up a program by company, or if you want to see if a company had a program at all, you can check here. We do list companies that maybe don't necessarily have an active program, just so that you can find that on our website and not have to spend any more time looking. You can also go straight to our application section. So this is where if you already know the name of the program or you're just reapplying, we go and print out an application from this section. You'll see we have the last date we updated it and whether it was new when we updated it. A couple things about applications and programs in general. They're constantly changing. Programs are constantly updating their applications, changing the medications they cover on a program. So you really always want to go and check that day that you're ready to apply to the program on our website. And if you do work for a facility where maybe you're helping a lot of people apply to patient assistance programs, don't print out a batch of applications like at the beginning of the month and start using them, because applications will constantly be changing. So you really want to go that day or that week at least and print it out. Also, another note, you'll see this copyright at the bottom of most of our pages. You can totally ignore that. We had to put that there because people will reproduce websites, so really don't worry about that. So that's the overview of the patient assistance programs. We do have a lot of other resources on our website that we're going to talk about now, but again, that's how you would look up a patient assistance program. And if you have any questions about applying to them, it can be confusing. You can just type those into the questions bar. Okay, we're going to talk about coupons. So we do have over 903 coupons listed on our website right now. Again, it's going to be listed alphabetically. You're going to see the name of the coupon, whether it expires, the specific offer, and then we'll try to link you to the closest place where you can find either print out the coupon or sign up for it. A couple things about coupons is sometimes they will only save you $1 or $2, but some of these coupons can actually be really helpful. And a lot of companies have been coming out with these copay cards for those who have insurance. And some of these cards can actually help cover up to hundreds, even maybe thousands of dollars a year in costs. So these really can be a great help. We also list coupons on not just prescription medications, but over the counter. So you do want to check this section. You may have noticed when we were on the brand name drugs list that you saw this little coupon icon here. This is the heads up to you available. Now you're still going to want to click on the name of the medication to see if you qualify for the patient assistance program, because that's really going to provide you more assistance. But if you don't qualify or you need quick assistance, you can click on this coupon icon here, and that'll bring you to the page where the coupon is. Application assistance. This is a section of our website where we list programs that actually help people apply to patient assistance programs. As you may have already known, or you can see from this webinar, applying to patient assistance programs can be a little bit confusing. There are a lot of different eligibility, different applications. So these are programs which will actually help you sort of navigate that process, apply to these programs. You can see all the programs listed in one state, or you can also put in a zip code and search up to a 20-mile radius. Okay, we're going to talk about disease-based assistance now. This is a very helpful part of our website, as this is where we list programs that are offered to people based on a diagnosis, and it's programs that will help people not just with the cost of medications, but all those other costs of healthcare that people are often struggling with, whether it's testing, equipment, travel, things like that. So you can look it up and look at DBA, is what we call these programs, up in 3 different ways. You can look it up by name of disease, which is what I just clicked on. So again, you see this A through Z bar here. We have a lot of different categories, so you're going to sort of want to look through it. I'm just going to go ahead and click on our, excuse me, our general chronic serious life-threatening illnesses. So this is more of a general category. You can see the name of the program, the summary, the services provided, and the area of service. When you look up a disease-based assistance organization, by disease, you're going to see all the national programs listed first. And as you scroll down, they're going to be listed alphabetically by state. And then if you click on it, it's going to bring you to more information how to get in touch with them. You can also look up a disease-based assistance program by the area of service. You can see all the programs offered in a particular state. If you click on cover, since you looked it up by the area, and then again a summary. So just another way to look up the same information. If you already know the name of the program, you can also look up a disease-based assistance program by name of the program. Okay, we also have a database of over 10,000 free or low-cost clinics. These are clinics that will offer their services free or low cost with a sliding scale based on income. So again, you can click on a state and see all of the clinics offered that we list in one state. I clicked on Texas, so we have over 600 listed in Texas. So you'll see the name of the clinic and the contact information, the eligibility, and the services they provide, the hours. These clinics will not just be medical services. Some of them will provide women's health, dental, a lot of different things. So this is where if you needed some low-cost health care or you know someone who needed that kind of assistance, this is where you could search. And again, we have that zip code search as well that we have in a lot of parts of our website. So I'm just going to put in where I live, which is in Boston, and I'm going to search up to a 15-mile radius. And you can see that there's 89 free clinics within where I live, within the 15-mile radius. So again, you could search right within the zip code, or you could go up to 20 miles. We're going to skip discount drug cards for a second, talk about camps and scholarships briefly. This is similar to our disease-based assistance section in that they're offered to children and adults with specific diseases or disabilities. It's also offered to children with family members with these diseases or disabilities. So you can look up a camp by disease, by camp name, by camp sponsor, or by camp location. You can look up a scholarship by disease, by residency of applicant, or by scholarship name. Okay, we're going to talk about disease resource pages now. So we're going to take a look at the chronic fatigue syndrome disease resource page, as Pandora just sponsored this page for us. So we worked together on putting this page together. So you can see we have a little description at the top about chronic fatigue syndrome. And then we have a list of medications someone might be taking who has that diagnosis. What's really helpful about our resource pages is this is sort of what we call a one-stop shop. So it's a place where we put all the information we know about a specific diagnosis in one place. On some of these pages, we did just put together ourselves. And like this page with Pandora, some of them we've put them together with other disease-based organizations. So what's really helpful about these pages is if you do have these conditions, rather than sort of looking all around our website, if you go to this page, it's a centralized location where you can see sort of all the assistance available. And a medication assistance program is available for that medication. And then if you were to click on the left-hand sidebar here, it's going to bring you to more information. It's going to link you to different parts of the Pandora website that will provide further information and assistance. So that's what a resource page is on our website. We also take a look at the fibromyalgia page. And again, it's going to be the similar type of thing where we're going to list all the medications, all the assistance we know that's out there, and just further information. So it's just a place where we've collected all the information we know about a diagnosis just to make it easier for you to find the information, because really we just try to make it as easy as possible for you to find the information you're looking for. We do have a database of government programs as well. So we have state programs, Medicaid sites. We already talked about the federal poverty guidelines and a tax return request form. One more thing we're just going to talk about is the drug discount card that we run. So you may have seen a picture of it on our homepage. So primarily, while NeedyMeds is an information resource, the one thing that we do run ourselves here is the discount card. And this is sort of just a thing that we like to provide to provide a little extra assistance sort of to fill in the gaps of affording medication. So if you click on that, it'll bring you to some more information. Also a card that you can download right from our website. The card is totally free to use. There's no activation or registration. There's no personal information taken. This piece of paper is actually ready to bring to the pharmacy, and it's accepted at all of the major chains and over 62,000 pharmacies nationwide. If you were wondering if it was accepted at like a local pharmacy near you, again, we have the zip code search. You can search within the zip code up to a 20-mile radius. So how does the card work? Basically, the only rule when it comes to the card is you can't combine it with insurance. So for those who don't have insurance, they can, of course, use the card. For those that do have insurance, if they have a medication not covered, they have a very high copay or deductible, or maybe they're in a coverage gap like the donut hole, they can try using the card instead of processing it through their insurance. They just can't use them you just can't use them at the same time. It's also good for anything written as a prescription. So if your doctor wants you to take any over-the-counter or medical supplies, as long as your doctor writes it on a prescription pad and you bring that to the pharmacy with the card, you may be able to get a discount on your medications. You can even use it on pet prescriptions you can pick up at a pharmacy. So again, even if a vet wrote a prescription out and you brought it to the pharmacy. So again, there's no income or residency requirements or anything like that, and it is totally free to use, so it can only help. It was just another way, an extra way we wanted to provide something that could help you. Again, getting enrolled in the patient assistance programs is the best thing because then you can get the medications possibly for free, but a discount is better than paying full price. So that's just one thing that we run here. And we do have a plastic card available as well, so you can send us a self-addressed stamped envelope. We'll mail you a card back. Also, if you work for a facility or an organization, we also send out batches of our cards and brochures out all the time. We also have just general brochures about our website available in several different languages. You can let me know if you're interested in getting any of those. And we also do have our website available in Spanish. That upper right-hand corner there, so you can go ahead and press that Espanol, and that'll bring you to most of our website translated into Spanish. So that's the general overview about NeedyMeds. We do have a lot of different resources, as you can tell. If you want to start typing in questions, I'll be happy to answer some questions. I just wanted to point out our advocates page. If you are a patient advocate, social worker, or nurse, this is a good place to look. It kind of goes over all the different resources we offer. We have a newsletter that we send out once a month. We have like our brochures, what I mentioned, and just a lot of different resources, the conferences we're attending. So if you are an advocate, you might want to check out that page. And that's sort of the overview. We do have some other special topic webinars coming up if you'd like to sign up for those. All of our webinars are always free, and if you're interested in getting any just NeedyMeds materials, brochures, or drug discount cards, we're always happy to send those out as well. And I don't know if Marley, if you want to say anything to sort of wrap up. And again, if you want to start taking any questions about NeedyMeds or the specific resources, neuroendocrine immune resources we highlighted today, anything like that, go ahead and type in some questions. And Marley, do you want to say anything?
A few things. First of all, it would be very worthwhile for us to get some feedback from the folks who are attending this webinar today, because we hope to do another one toward the end of the year. And so that would be something good to hear from anyone. I do have actually a question for you, because I actually want to know more about your site today than ever before. With being a May Awareness Month, I actually think I should be getting some material from you to disseminate to some of our members as well.
Great.
So
we'll be happy to send those out to you.
Exactly, and I want to encourage everybody here also to request this from you as well, because it's just something they can share on their support groups and so forth.
Go ahead.
Go ahead.
Oh, I was going to say, if I wanted to give out my contact information just before I forgot to do that. So
Exactly.
Anyone can get in touch with me to get materials, any questions they think of later. Please get in touch with me. So again, my name is Elizabeth Messenger, and the email address is elizabeth@needymeds.org. So that's ELIZABETH@needymeds.org. And the phone number here at the office is 978-281-6666. Okay, go ahead.
That we see on your website, are they also included within your database?
No, some of them are. A couple of the programs that we list, we try to be very selective with our advertisements. Those are just being on our website. So a couple of them, like RX Outreach, is a program that we list on our website. Otherwise, there's sort of other reputable organizations that wanted to support us.
Very good. Very good.
I do see some questions, so I'm going to start answering the questions that have come in. There's a question about whether income is based on family or individual. Most of the time, the federal poverty level guidelines do base it on household income. So it's based on household size and how much, There's a question about why you've never heard of us. We are trying to get the word out there more. We're just a little nonprofit. There's not a lot of us working here. We're just in a little suburb of Boston. So we're working on getting the word out there. If you do want to, you said you want to put us on our website, just send me an email, and we'll be happy to provide you with a link or any information to put on your website. That's definitely fine.
That's right, Elizabeth. I'm sorry, Elizabeth, if we have any bloggers who are attending this meeting today, it would be worthwhile for them to spread the word also to their blogs.
Any resources for kind of non-traditional, those we just can only list so much information. So we don't really have any information about that on our website, really mostly just for the, so that's the answer to that question. There's a question about someone whose daughter, maybe me and Marley together. Marley, do you want to give your contact information, and maybe this person can reach out to both of us?
Absolutely. You can reach me on my cell phone at 954-629-0976. They can go to, it's msilverman@pandora.org with hyphen between the word Pandora and a dot up the letter A.
So Sabrina, if you wanted to just send Marley and I an email, I'm sure we'll be happy to work with your daughter on any type of news that she'd like to put out about us, because we definitely want to get the resources out there, and it's important people know about all the different resources that are out there, because as that other person mentioned, there's not a lot of this isn't advertised. A lot of people don't know about patient assistance programs and all these other resources. So certainly get in touch with us, and I'm sure Marley and I will both be happy to work with you on that, or work with your daughter on that.
Absolutely.
So I think then there was another question about the income. So this is based on household size usually. So that's what they base it on. So it is usually a family household size income. Were there any other questions? Again, you can definitely get in touch if you think of any questions down the line, or you do want to request any of our materials. We'll be happy to send those out for free. There's a suggestion about a specific medication.
Oh, Elizabeth.
Yep.
What I was going to say, did you also explain to them that prescriptions they're not FDA approved are not included in your list, correct?
Yeah, that's correct. We don't have any medications that are just in clinical trials, and we do usually wait until they're FDA approved. Yes. And there was also a suggestion of a specific medication we should perhaps add to the resource page. So I will, do some research, and if that makes sense, we'll definitely go ahead and use your suggestion and add that medication. Court. Any other questions?
Okay.
So I know that I really appreciate you all taking the time to learn a little bit more about the resources on our website, and we're really excited to have worked with Chef. There's one more question. So there's a question of getting assistance for a medication that's FDA approved, but not specifically approved for your condition. That's going to vary from program to program. So some programs do require you be taking it for an FDA approved diagnosis. Some programs do not require that. So if that's the case, you're going to want to, we always say when in doubt, call the program. If you're not sure you qualify, it's always better to call and find out you do qualify than to not call when you actually do. So with questions like that, if you can't find it listed in our information or on their application, call them and see if it has to be an FDA-approved diagnosis. Okay, I guess that's it. Marley, do you have any last thoughts?
Well, we hope that we have been able to record this correctly, and if the recording comes out in good shape, we're going to most likely put it in a link, right, Elizabeth? We can put it in a link, and their convenience and their leisure time. And again, I just want to reinforce, please send us your feedback about this type of program that we're doing here. It's a collaboration with NeedyMeds. We hope this is going to grow and being able to help patients with chronic fatigue syndrome, fibromyalgia, chronic Lyme disease, multiple chemical sensitivity, and Gulf War illness, because these are the illnesses that we embrace, but primarily PANDORA page, which is the myalgic encephalomyelitis and chronic fatigue syndrome page. And I'm grateful, and to Elizabeth and Dr. Rich Segal for doing this wonderful, really, I mean, this is like what you said, it's a yellow pages for prescription. It's one-stop shop, and we're very, very grateful for being part of this as well. Thank you so much for attending today's webinar.
All right, thank you. I hope everyone has a great rest of their afternoon.
National awareness statement for all of you. Thank you.
Okay,
and thank
bye
you,
everyone.
Bye-bye, Elizabeth. Bye-bye, everybody. Bye, everybody.